Okay.
It's 5:16. I'm gonna call the December 2020 Board of Trustees order. Before we begin tonight, Jack, do you mind leading us in prayer?
Anthony, you were going in and out. Who did you would like to do that?
Jack. Can you hear me now?
Jack.
Yeah, you want me to do it, Anthony?
Yeah, fine, please. Appreciate it.
Yeah, okay. All right, let's pray, guys. We pause just this moment, oh Lord, to give you thanks and honor and glory. And Lord, as we go into this season of Christmas, we want to make sure, Lord, that we always remember the true reason for the season, the birth of your son, Jesus Christ, that awesome gift of love that you gave to us so many years ago. Lord, we also pray that tonight that we do all things pleasing in your sight. And Lord, we just pray that our decisions will be to the upbuilding of the health system and for the care of all those that are in our county and surrounding counties. Lord, but we pray most of all for your love, your grace, that we might share that with others when we come into contact with. Lord, we love you this evening, and we thank you for Jesus. In his name that we pray. Amen.
Thank you. Thank you very much, Jack. This meeting is pursuant to the governor's executive order as amended by Executive Order 65 on 10/20. It allows a governing body electronic. A recording of the proceeding will be posted on the Lincoln County Health System website for the public to view. The first agenda item is are there any items in the consent agenda that any of the board members would like to be taken off for further discussion? If not, I entertain a motion to approve the consent agenda as presented.
So moved.
Who was that?
Dr. Morrison.
Okay, Dr. Morrison. Need a second?
Second, David.
Okay. All those, any discussion? All those in favor say aye.
Aye.
Okay. I'm just for clarity, Donnie, what was your vote?
Donnie is not on there.
Okay, Donnie's not on. Okay. Okay. John? Commissioner Thorpe?
Aye.
Commissioner Ashley?
Aye.
Commissioner Sanders?
Aye.
Okay. And Dr. Morrison made the motion. Okay, motion passed. The next agenda item is the quality report.
Hey, good evening, it's Courtney. So we did have a quality council meeting yesterday. Anthony, thank you for attending that.
Having me.
Huh?
I said, thank you for having me.
No problem, no problem. Glad we finally got to escape COVID for just a minute to have one. Patient satisfaction, inpatient and outpatient are holding steady at our goal right now. There has been a slight decrease in the ER satisfaction, mainly due to our volume with COVID. We have more days than not are just absolutely covered up, which with COVID going on, you have increased wait times, and that's going to cause a little bit of decline in that satisfaction. Fourth quarter is still pending, so we do not have final on that at this time. We did have one performance improvement project. Of course, it was related to COVID. Since our last meeting, it was in our outpatient COVID area. We did a lean project, which is just a tactic we use for performance improvement to improve our patient satisfaction in that area and decrease wait times. We now schedule those appointments from 9 to 2 with a doctor's order, and they still pull to the outside and have those done. We have not had a delay at all in anybody having to wait for the next day to be tested. So that's helped our staff in their processes and throughput in that, and it's also increased our patient satisfaction in that they don't have to wait a long time when they get here. As far as the regulatory update, you all have had a chance to review all of that. If you have any questions, I'll entertain those, but there's not a lot to update. The only thing that I would add is that we have submitted our payment and license to continue being licensed as a hospital in 2021. So that's been completed. Any questions on the regulatory from anyone?
Can we just mention that the lab will be delayed again?
So you have it on your sheet there, but Carrie did want us to mention just to know that the lab has been delayed on their survey. Once again, we may even go past that 12-month mark of February. It's solely going to depend on COVID in not only our hospital but other hospitals. The way that survey is done is that an acting lab director from another CAP-certified facility comes in to do that survey. And so if his facility or her facility is overwhelmed, that person can't get away to come do the survey. So that's why the delay in the lab regulatory visit. As far as a COVID update, we talked about the antigen testing already. I think Carrie may expound some on this, but we are at an unusually high volume of COVID-positive inpatients, some ventilated, some not. That's been going on over the last 8 weeks. We are utilizing both our ICU as a COVID unit as well as one full hall on med-surg, and they are essentially both staying full at this point. In addition to that, we have lots of staff who have had exposure, and we've had staff out sick during this time as well. So it's definitely been a struggle. We know that's not only our hospital. We've been in contact with Candace Wilkes, who is our contact with the Department of Health for Emergency Management, and today alone, and they've wanted additional information in addition to what we report all the time on the number of patients we have and the number of ventilators that are in use, because we're looking at a South Central region surge plan at this point. So, it's not just us, it's becoming a struggle all over. And then for the vaccine, I'm going to give you the latest and greatest update. It's even as fresh as less than an hour ago. So originally our anticipated vaccine date was December 28th. We did find out last night that we would be getting that shipment today, only to find out at 4:30 this afternoon that we are not getting that shipment today. So we've done our planning. We have our list. Once we get that vaccine, we are ready to go. We're at the mercy right now of McKesson and the Department of Health getting that to us. We do have to follow the CDC and Department of Health guidelines for a phased approach. It's highly regulated because it's an emergency use authorization, and while it's approved by the FDA, it's only approved for this pandemic and hasn't been through the full process. We have to follow the very strict guidelines that have been given. So the first group is phase 1A, and we've sorted our employees who want the vaccine into that group, and they will receive notification when we get the vaccine. They'll receive notification of what their time frame is to come. They'll have to come at that time frame to be guaranteed to get their shot. We can't do one on Wednesday, one on Thursday, because once we open that vial, there's 10 doses, and we have to use all 10 doses or the vaccine goes bad within about 6 hours. So it's a highly regulated, very complicated plan that we have out, but we are ready to go. There is a possibility we could get the vaccine tomorrow. If we do, we may do a clinic for some employees tomorrow evening. If not, it will be time dependent based on when the vaccine is delivered.
Which one
I know
are we
that's kind of a hot topic.
Are we getting the Pfizer?
Go ahead.
Are we getting the Pfizer?
No, sir. No, sir. We're getting Moderna.
Okay. We have the facilities to maintain it where it doesn't lose its quality.
We do. We do not have a continual high alert system, but we have what is required by the CDC and the Department of Health, and they actually sent us a digital data logger to use for our temperatures that's approved and calibrated by them.
Okay, thank you.
Any other questions on the vaccine?
So how many units did you get?
We don't have any yet. The communication we received is that it will be 100 doses.
100 doses. Okay.
But there again, that's the current communication, and at this point, to be honest, I anticipate everything they tell me to change until it's in my hands.
Okay. Is that 100 doses supposed to be allocated for the nursing home?
No. So that information also changed. Originally, nursing home was included in our amount. That has since changed. They will have a strike team from Walgreens that come out to immunize their residents and employees. The anticipated date for that right now is December 31st to come there. Now, with that being said, once we get through our phases, if we have extra vaccine, then we can use that for our employees at Donaldson, but not for our residents.
Okay. Do we have a pretty good rate of residents that would like to take the vaccine at the nursing home?
We don't have the amount of residents at the nursing home yet who want to take it because you can't give out the consent and ask for consent until you have the emergency use fact sheet, and that was not available until Friday last week. So that has been sent back out. I will tell you, I've talked to several, and there's quite a bit of interest in it.
Okay.
But as far as giving you a number or percentage, I can't do that.
Okay. Any questions for Courtney? Are you going to do the next one, Corky? Okay.
Corky? Corky is going to defer that to as reported.
I was
as
hoping
submitted.
Okay.
You got me all tore up, Anthony, calling me Corky.
Any questions, Courtney? If not, entertain a motion to accept the quality update for LM and quality reports for HHH.
So moved.
Okay, motion made by Commissioner Ashley, second by who?
I second, David.
Okay, Commissioner Sanders. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay.
Aye.
Opposed, say nay. Okay, reports have been deemed accepted. Senior Administrative Report. Nursing Quality Report.
Well, good evening. Courtney gave you the update on the vaccine just now. I would quickly tell you that COVID here in the hospital is very, very high census and a very high sickness rate with our employees. Most of those employee sicknesses have been contracted outside of the hospital. I would say 100% of those, maybe one or two, but very few had been because we have good PPE. They're not getting it here. They're getting it from their, from their associations and home at times when they're visiting with each other or whatever. So it's been very difficult to get appropriate staffing due to so many nurses being out sickly. Also, a part of that is just the very high acuity of our patients. The patients that we have are sicker than what we've seen, and so it's just a very stressful time in the hospital for taking care of patients. Our nurses are very, very tired. We are having to use a lot of overtime because we just don't have enough help. Ordinarily, we would be using less staffing because we wouldn't have so many patients. So we've had to ask our nurses to work bonus shifts to get everything covered so that we can have enough nursing staff to take care of the patients. The good news that I have on the COVID front and that I wanted to make sure that you knew is that the hospital has the absolute very latest on evidence-based practice for the treatment of COVID-19. And I wanted to make sure that, if you get a question in the community, that you can assure the community that we are doing the exact same things that Huntsville Hospital and Vanderbilt are doing for the patients. One of the things that we are doing are giving outpatient what's called monoclonal antibodies. That medication is very difficult to say. I'll say it once, but there's no sense in me repeating it. Bamlanivimab is the name of the medicine. But at any rate, those patients that are low acuity, that high risk, they qualify for this medication and can get that. And I just wanted you to be assured, and so that you can know that we are doing everything that the big hospitals are doing. And we've already given the information to the medical staff about the bamlanivimab for outpatient use, and we've already had numerous doses been given just in the past 2 days. I think we've given 6 doses outpatient in the last couple of days. Any questions with that before I move on?
Any questions? Please.
Okay. We did receive our free ventilator from FEMA. We were a little disappointed in the ventilator. We're very thankful to have it, but it is a transport ventilator, so it's not a full-size one. And so, we'll be able to utilize it, but not in the regular capacity that we would a regular ventilator. So you see on the third bullet point, I said that we have gotten our new ventilator. Really, that's actually wrong. We did get it, but it's not 3 regular vents. That second sentence, it would be 2 regular vents and 3 transport vents. That's what we have now. So those numbers need to be inverted there. I would just want you to know that Lincoln County is one of the highest in the state per capita of new COVID cases every day. It's very disappointing that Lincoln County gets to be number 1 in that area. I would like to see that the people that are in these public spots, like you and I, the doctors, that we continue to ask people to socially distance and to wear their masks, because really that's about all we've got for the community. So that's the COVID update. The numbers keep rising, and we suspect that January is going to be as tough as December and November have been, just because of Christmas. So,
Karen, I know last month we had talked about purchasing a ventilator, and we were advised that we might be able to get one that would be provided to us. Do we still need to continue to do that, since what you received was more a transport and not what you were hoping to get?
Right. Originally, when we got the message from the state that we were going to get when we were going to get a ventilator, we were excited, and we actually had the name of the ventilator, and we thought, oh, that's going to be great. Well, it showed up in the mail, almost literally in the mail, and it was as big as a handbag. And, we thought it was going to be coming in, rolling in a big box, and it literally is the size of a satchel. And so we were disappointed, to say the least. But we talked about it today at senior team, and I think it's definitely on our radar. If we can come up with, we've spent a lot of our capital money, and we don't have a whole lot left, but we know that that's something we may want to purchase in the next couple of months. So I'll leave that to the financial folks.
I would recommend that we go ahead and purchase that and put that in the form of a motion if that's acceptable.
Okay. How would we fund? Do we have some items that we're running under as a budget that we can take that and apply that toward a ventilator? It seems like that's a critical piece of equipment we need to have, especially if we're going to be using the latest evidence-based practices, the same thing that big hospitals do.
Well, Anthony, we've got about $143,000 left, and there was another item that I'm going to ask for when we get to the capital section. So if you approve what I'm going to ask for in the capital section, which has to do with EMS and the ventilator, then that's going to probably take us very close to having no capital left for the remaining 6 months of the year.
Well, let me ask you this then. comparing what EMS is requesting versus getting a ventilator, which is the most critical piece of equipment?
I would say they're about even, to be honest with you. Yeah.
Hey, it's Courtney. The difference in the two would be that the piece of equipment EMS is requesting is going to be a protection mechanism. It's going to be a huge protection mechanism for our EMS staff.
If I could, would it be acceptable if you approve the EMS equipment later in the meeting, that we kind of play it by ear, so to speak, on the ventilator, and maybe delay that or push that out another month or two?
Okay,
Is that acceptable to everybody?
well, let me ask you this.
What do you think?
On the request for EMS, why did they put that in the budget when this first started last year or this year? And do they have a line item that can be used to fund that they're not funding?
Well, we would just, we would definitely, take something off the capital list to replace the EMS. This is a relatively, from my understanding, a relatively new piece of equipment or device that the other surrounding counties have, but they also have it, and it not only protects our employees from maybe contracting something from a patient, but also this device, which is, I'll just go ahead and talk about it. It's a mechanical CPR device, and we're asking for 3 of them, and they would go in each of the trucks, 1 for each truck. But what it does, John and Jack and David and Anthony, is that it, instead of a paramedic doing manual CPR compressions, you have a device that you put in place of where the hands would be, and it automatically does the compressions for the personnel on the truck. So if you're like 20 miles out or 20 minutes out, you're not having to physically do CPR for the 20 minutes while you're driving into the hospital. This machine would be doing that for you, and it would be more systematic and be more methodical, and the rhythms would be more precise than probably what you would be doing in a CPR, just because of the time getting here and the energy and exertion by the employee doing the compressions. It won't be as simple, systematic.
Yeah.
Daryl, they're about $14,000 a piece.
They're right at between 13 and 14,000. I've got the quote right here. It is 13,877.
Yeah. Okay.
And then you have some like a battery charger and a power supply that goes with these compression devices.
Right.
And hey, Anthony, this is Russ. If I could just speak up on this as well, and it's unusual to have both these big requests at the same time, but we certainly couldn't have anticipated everything that the EMS crews and the hospitals having to deal with now with the number of ventilator patients, and also just from an EMS standpoint, the number of runs that they're making out into the community to pick up patients who have been who have COVID, and so I think it's just extraordinary times right now. And one of the things that may perhaps the board consider as well is we do have a number of stimulus dollars out there and available to us, and I know there will be an accounting for that at some point with HHS and all. And I think making an argument for justification of ventilators and these Lucas devices, I think that's, to me, that I couldn't think of anything that would be more appropriate from a COVID standpoint in the eyes of the feds or anyone else that might scrutinize that transaction.
But we already got the stimulus for the purchase equipment like that.
with the first round of stimulus, there was money that went to EMS, and I can't tell you that it was either in the 30s or $60,000. But we've received a number of payments along the way. Home health, nursing home, hospital, EMS, all have received monies along the way. And I think just talking with Richard Wright, I think that's where some of the other services in the surrounding communities, like Moore County, Lawrence County, I think they've been using some of their stimulus dollars or CARES Act dollars to purchase these devices. Again, prior to COVID, or at the start of COVID, when you think about Lincoln County, through the end of May, we probably as a county didn't have more than 30, 35 patients to test positive in the county. And as far as hospitalizations, we had a total of 3 by the end of May. Now, on probably most days, we have there are days of 10 and 13 and positives in the hospital. So just unusual times, and no way to really anticipate what we're experiencing at this time.
Well, Daryl, can we take some of the stimulus money and buy those things for EMS? It comes up a little less than $42,000, but it's close.
Well, when I talked to Bob today, he said that a lot of the stimulus money is already in our capital dollar allocation. But that's what he told us, but I'm not really sure about that. I need to probably find out more about that.
I think you need to go ahead and use the stimulus money to purchase those for EMS. And then I think whatever budgeted to get a ventilator, we should go ahead and get a ventilator and put that in now. I thought I heard with Ohio State. I think Kerry said that at the very beginning. And we are a red zone area. So that means that we're going to get more COVID cases, means that we're going to need for a ventilator, probably more than what we got right now.
Yes, sir. Okay.
So if we can map out some of that stimulus money, it won't impact the budget for that particular offering right there.
Okay.
Now,
we'll definitely do that then, Anthony. Look at doing that.
John made a motion that we go ahead and purchase a ventilator. How much does a ventilator normally cost, the kind that you want?
The kind that we would like to see purchased would be similar to the one that you approved about 2 months ago. Okay. And we got it for half price. It's about $35,000. If we can get it for that same price, $35,000. Originally, it was $60,000.
Okay. John Thorpe made a motion to go ahead and purchase a ventilator. I need a second.
The second, David.
Okay, David. Any questions? Dr. Morrison, are you okay with that?
I think we have to have both of them for the care of the patient. They're 2 different reasons, but I don't see us not getting them.
Okay.
We're wearing out our meds, and if you've ever coded somebody, it is very tiring and exhausting, and you're trying to balance in an ambulance. I've been there, done that. I think these machines are wonderful, and we know we need the ventilator.
Okay. All right. Any other questions? All those in favor say aye.
Aye.
Opposed, say nay. Okay. I'm sorry, Kerry. You got your.
That's all right. I'm just going to finish up with clinical contract evaluations and report to you on that. How the hospital does clinical contract evaluations, it is required regulatory to do it annually. It is comprised of 3 components. The first component is the department rates or evaluates the company based on timeliness, availability, safety, clinical outcomes, staff competency, and customer service. So the department director will get feedback from staff, and the department director will also provide data such as throughput, turnaround times, that type of thing. So the department evaluates it, then the senior team administrator will evaluate. And then the third piece of that is we ask that the medical staff evaluate as well. So what I've got here is what normally comes through for annual clinical contract evaluations, and that would be that the medical staff, the first thing that you see is the medical staff evaluations. What I did is ask the medical staff to evaluate at the last medical executive committee, and then what I do is I take all of those scores and average them out and put them in here as one lump sum score. And then the second paper, or the second piece of information there is just the list of clinical contracts and whether or not the fully will be recommended for renewal. After doing the clinical contract evaluations, the only clinical contract that will not be renewed this year will be the Capture RX. That is our outside pharmacy clinical contract with 340B. This company has, if you'll recall, we had some serious difficulty in June of 2019 when we started with Carter's and Walmart. We had thousands of ineligible prescriptions go through. Thankfully, over a year, and through the help of Russ, Bob, and Angela, we finally have gotten that piece fixed and reversed so that we are not in trouble with HRSA. But this company has not done us a very good service, and so we are going to let them go goodbye. And the other thing, I'm sorry, Anthony, I didn't hear you. Could you say it again?
Who are we getting to replace them?
Well, that's a great question. We also, let me just kind of tag onto it real quick. We also had, in the month of October, we had our 340B required mock HRSA audit. That audit was done by the company that we use for our pharmacy, CPS. They have a subsidiary that comes in and will do mock audits for you. And his recommendation to us was to eliminate the outside pharmacy piece. It is lucrative, but is also riddled with the problems. And so his recommendation was, because that piece is so riddled with problems, he recommends not doing the outside contract pharmacies. Just stick with what we do best, which is procuring medications here for our outpatients and getting them at a great cost.
Well, can I ask you a question? Does the one rating that is across the board, does that apply? That applies both to inside and outside, doesn't it?
I didn't understand your question. I'm sorry.
Does the rating that you listed here, it applies to both inside and outside pharmacy, doesn't it?
No, Capture RX just does the contracted pharmacies 340B.
Okay, outside.
It's basically just, it's outside. It's basically just a computer program. It's a software company.
Who do we purchase our infusion drugs from?
That's a good question. We use the 340B optimizer at the bottom. If you'll go all the way to the bottom of that list, it says 340B optimizer, pharmacy 340B service, and it gets all fours.
Okay, good.
Because they do a fantastic job. Yeah.
With APP emergency department physician, you had 3 areas that were marked 2, which means fair. One was clinical outcome, the other was staff competency, and the third was customer service. All of those impact our quality of how we deliver care. I noticed that you recommend that they continue to be a provider. Is there a Is there are they going to address these areas as an improvement area? Or have we just ignored it and just went ahead and recommend that we just continue with them?
Okay, that's a good question. So we absolutely will be working with APP to improve clinical outcomes, staff competency, and customer service. And I can share with the board next month possibly an improvement plan. But I would just also like to remind you that the clinical evaluations of these contracts is threefold. And the one you're looking here is a physician's, okay? The staff in the ER are very pleased with APP. We have the staff believe we have a great set of doctors. And then I have a long history of working with ER docs. I worked in the ER at Winchester. I worked with Team Health. I've worked with independently owned or independently contracted physicians, and I've worked with APP here. APP does a really good job. They're very responsive to when we have a problem or we have a physician that we need to work with and possibly not have them renewed. APP does a great job getting back with us. So I'm not saying that we don't have a problem. I just like to remind you that this is only one tenet of the full complement of things that we do to evaluate the contract. And they are very responsive, and so I don't have a problem with APP at all. I will be talking to Dr. Peterson about some physicians that work on day shift that are slower than they need to be. I talked about that with Daryl this afternoon, and we're going to send to Dr. Peterson an email and see if we can't change up how they do the schedule so that we have our quicker doctors or our, the ones that don't take as long. The throughput is better on day shift, which is when we have the bulk of the patients. So that's the type of thing I'm talking about. But I'll be absolutely glad to do a work plan to improve and maybe get physician relations, improved. I really would like to see Dr. Seaman coming to the medical staff meetings. I think that would improve the physicians' relationships with the APP docs.
I think part of the deal is that APP, we had a kind of an uproar about it. We are directors, and a lot of this is the frustration we've had for the whole year. I agree with Terry. I think it's improving a great deal. We're not perfect on our choices of doctors yet, but we're better than we were.
Well, when I see staff competency, it bothers me. But I'm hearing that may not be as bad as being reflected here.
Yes, sir.
Okay. If what you think it was just the action of the people who were voting, who were evaluating this contract, that emotions got in rather than common sense?
Well, I think there's some frustration. I think there's some frustration with certain physicians.
Okay.
And that colors the picture about the APP. One bad apple does not spoil the whole bunch. Can, but you need to get it out. APP is very attuned to doing that for us. This is, I'm sorry. I think they're better than they were last year, without any doubt in my mind. And I think the quality of our doctors, I think they Carrie has nailed it. Having some of the slower ones on day shift are probably not in our best interest, either for staff satisfaction and patient satisfaction.
Okay. But you working on an improvement plan with them, Carrie?
I absolutely will. I will get with Dr. Seaman and we'll work on some, 3 or 4 things that we can do to, even if it's just a perception issue. And I'll give you an example. One of the staff competency issues, I know that came from a pediatric perspective, and so we could do some perception issues on treatment with pediatric patients, maybe have Dr. Spears do an in-service for the ER docs. I mean, that all of that it just improves the perception of things.
Well, sometimes it's just being able for them to pick up the phone. Like when they handle OB, they'll pick up and talk to me and say, this is what I have, this is what I want to do, how does that sound? And because I'm on call, I'll talk to them, and I'll tell them what I would do. And this, you know, they just don't see some of this stuff real often.
Wow, they need to put you in retainer then. Carrie, the other thing, the radiology of Huntsville, timeliness was rated a 2, and customer service was rated a 2. Will they be on a performance improvement plan? Because those two areas impacts us from a quality standpoint.
Yes, I will work with them, Anthony. I sure will. The only issue with, you know, just to be completely honest and transparent, the only issue we have with Radiology of Huntsville is that we do have our hands tied. So I will do my best.
They're getting better, Anthony. They're better now in December than they were in October.
Okay. All right. Okay.
What I'm concerned about, I just can't believe that the lab people, we voted LabCorp as 3. That is the slowest turnaround time of any lab I've ever seen in my entire life. I just want to go on record as saying that.
Somebody put on here, slow turnaround, please use PATH.
Now, that was probably me.
You did.
Oh, okay.
So let me talk about LabCorp real quick, and then I'll try to let somebody else go. LabCorp, we have a contract with HPG, and HPG, you know, that saves this hospital literally thousands and thousands and thousands of dollars. And one of the companies that sort of comes as a package deal would be LabCorp. We currently are in the middle of a 5-year contract with LabCorp. It was signed maybe 2 years ago. So there's really, LabCorp is just one of those things that comes with HPG, and I'll do my best to try to figure out a way that we can improve some turnaround times of some. But here's the thing. When I look at the turnaround time, they give you a report. You know, I have to evaluate the turnaround times for this contract, and I can share that with the medical staff. I can share that with Dr. Morrison, but their average turnaround time is not too slow. So I can see if there's one particular type of lab that the docs are talking about, and see if we can't figure out a way to get that back a little bit quicker or something. But overall, LabCorp, because it is a monstrosity, it's so big, but they don't do too bad. They just, you know, it's a humongous company. It's just massive.
Okay.
And LabCorp, Pass Group does do an incredible job, and it would be great if we could swap to Pass Group, but we would lose out on a lot of HPG pricing if we did.
Yep. Okay. I think we just recently signed a 5-year contract with HPG, didn't we?
Yeah, we're in with HPG, yeah.
Okay. But there's still an expectation of meeting expectation. Okay. All right. I'm sorry. Anything else?
So, no, that's it.
Okay. And then the recommendations on your last sheet, overall recommendations. And you're going to work on you're going to be working on the performance improvement plan with those 2 areas that we talked about. And you're going to be looking hopefully at HPG to see if there's any flexibility.
Yes. Thank you.
All right. Finance.
Okay, Anthony, Bob, he's not here. He had something with his family tonight, so I'll go over the finances and just kind of do a high level. If there's any questions later that any of the members have, Bob will be back and you can be able to ask him. But if you got the scorecard in front of you, the dashboard, I'll just kind of go down and kind of hit the high points. As far as the hospital, the month of November, we had a very good month. We had an unusually high inpatient and inpatient as well as a high Medicare inpatient-wise. our net revenues were above what we had budgeted. And so as you can see, we were $50,000 to the positive. The Patrick Rehab Center, it posted a positive number also. It was below budget, but it posted a positive number for the month. The EMS services, again, was over budget as far as the finances. They're running around 500, in the mid 500s as far as runs. They're not doing as many transports from, say, one of the nursing homes or transporting people to dialysis just because of the COVID situation. More and more people are staying in their care centers or in the nursing homes and things of that nature. So those types of runs are down, but we did post a positive number there. Our physician clinics, a little bit over our budget than what we had budgeted, but we're having meetings with our physician clinics and operations and going over those, going over their finances with them and their operations. Home health, it's really busting at the seams, so to speak. A lot of people, instead of going to care centers or nursing homes, are selecting home health, and from home health, or home health and hospice. So we're not seeing many, we're seeing a lot of admissions to those two programs. And then the care center, it posted a profit, and it was over budget, but our census for the month was about 89 ADC. And, we were, several months ago, we were up into like the 115 to 120 range, and it's going to take a little time to build that back up with, the COVID situation and people, selected to go to a care center. So that's kind of the high points of the finance portion of the dashboard. You can see on the next page that Bob has presented is our Blue Cross negotiations. Our rates will go into effect Friday, which is Christmas Day. So it's kind of a Merry Christmas surprise there. Nice gift. Also, you can see in the next couple bullet points are the COVID assistance and the COVID testing costs for the staff here at the system. And then as far as our SBA loan forgiveness update, we filed the paperwork for the hospital on December 15th. It was due on the 17th, but we filed it on the 15th. So that's in process. And then Bob reported to the Finance Committee that the loan for the nursing home or for the care center was the $1 million was forgiven already by per First Bank, who we dealt with on that situation. So that's kind of the highlights of the finance report. I'll try to entertain any questions that you may have, but you have the information in front of you.
Okay. Bob,
Hey, Darryl.
Excuse me. Question?
Hey, Darryl, one question I would have is, I see the hospice way above budget, but it looks like the home health admissions are actually below budget. Or do we have any idea why that is?
We've got other than we have more competition, I guess, in the county, and these home healths are kind of springing up everywhere. But I know that Debbie and her staff are out there, marketing to our physicians and things and the clinics. But John, to answer your question, I do not know the real reason that they are down as far as the home health visits, other than what I just stated.
Yeah. It kind of looks like it may be, we've got the same staff and we're working really hard, and we've got a lot of hospice patients, and we're just kind of setting home health kind of to the side, and worried about that. Maybe we don't have enough staff. Could that be somewhere in the ballpark?
I think you're right on that. Our hospice has really increased, and it's pulled some of our staff to work in the hospice area. But overall, I think we're pretty well staffed in home health and hospice.
Good.
We do have, I did approve a PRM position to help with the call so that we can, help our full-time employees on the call situation. This PRM will just kind of fall in the call rotation. It takes about 2 to 3 hours to do open up a home health visit. And so if they're on the weekend doing a home health visit on a Saturday, opening up a new client, somebody else needs them in the hospice area, it's going to delay. They're going to be delayed getting there. So I'm hoping this PRN position will help, alleviate any delays in care that we're providing.
Yeah. On the outpatient visits, if we back off all those COVID tests, how many outpatient visits we would have had?
Our outpatient bit on the COVID test, and Courtney's going to probably have to help me on this. We have about 2,000 COVID tests?
In October, we had 1,812, I think was our number.
Okay.
No, that was total. We had about 1,100 because there was 700 employees, so about 1,100. I'm sorry.
So if you back out those COVID, then we're probably close to budget, maybe around that area.
Okay, good. All right, thank you.
Darryl,
Okay, you're welcome.
On Bob's write-up, he said that he had taken grant money and converted that to revenue. Is that line item of 167,204? And if so, we'd have had a loss this past month if he didn't have that grant money to use the revenue?
For the care center?
Yeah.
Yeah, so that's correct. That is correct.
And the reason that
it would.
I'm sorry. Go ahead.
I'm sorry. It would have been probably been a negative margin of approximately 60,000.
Okay. So
if we had not received that state COVID money.
Okay. So it's expenses and contracted, and we got a plan for the contract employees as we hire new staff.
Absolutely.
Okay. Well, we need to expedite that. Okay.
Well, we're HR is working on recruitment, and Jack is also working, talking with the current staff out there about potential people they know that would be interested in coming to the care center. So we have it on our website. We're using the service Indeed for helping us with the recruitment. So yes, sir. As we hire staff to the health system, we will systematically eliminate the agency personnel.
Okay.
Hey Anthony,
I'm sorry. Go ahead.
Hey Anthony, this is Russ. The other thing I would mention, just add to what Darryl said there, when you look at the nursing home, our skilled days are up significantly compared to last year. They're up over 700 days. But if you look at our long-term residents, that count, we're down 1,500 days. So, and you figure each day skilled ICF days a little over $200. So there's $300,000 less revenue in the 1 month alone, in the month of November. So it is important that we're managing expenses. But the other thing we got to do is we've got to rebuild that ICF census. And if we're down in the 40s now. It wasn't too long ago we had 95, 96 residents in house. So we've got to rebuild as many as 40 plus residents per day, and we just haven't had the skilled admissions. With a lot of those that will convert to ICF, and it goes back to COVID. The hospitals not doing surgeries and a number of things, but it's all of that domino effects there. And same is true with the home health admissions as well. If we don't have skilled patients that go home with home health, then we don't have an admission. Or if hospitals aren't doing as much elective surgery, because of the COVID cases, then we don't have that pipeline for home health admissions as well. But you're right, with the care center, it's without the stimulus dollars, without the state dollars, we would have been looking at a significant loss this month for the month of November.
Okay.
And Anthony, just to add to that, what I have Jack doing as far as admissions, every Friday he reports to me the number of admission possibilities or candidates that have inquired, and then also the number that have been accepted. So last week we had 7 that inquired about admission. We admitted 4 of them. One of them, the remaining 3, one of them decided to go home, and the other 2 were still in the hospital and were deciding whether to come to the care center or not. So I'm having him do that every Friday for me.
Okay.
And that's just an example of last week.
Okay. Okay. Your report now.
Okay, I didn't know we were finished with that, so we'll go to mine.
Yeah.
You have my report in front of you on the next couple of pages. I'll hit the high points. The first one on the growth pillar, Richard Wright and I went to the county commission based upon the board approving last month the exclusivity for EMS services in Lincoln County. We presented that before the county commission, and that was unanimously approved on December 15th. So we have that in place. Carrie and I and Bob are still working on our pro forma for Hologics Wound Care. We'll continue to work on that. We have another meeting with Hologics in early January. Happy to report that Dr. David Kersey, who's a urologist in Columbia, he's starting to come to Fayetteville. He was here December 9th, which was a Tuesday, and he'll be back in January. So we're looking at him coming hopefully at least one day a month, but possibly 2. And then so that'll be a big addition to our medical staff, and he's working to gain medical staff privileges here at the hospital in order to do some procedures at the hospital. And then Dr. Uzi, who was one of our candidates for the hospitalist program, he's accepted employment with Lincoln Health Systems, and he'll begin on January 4th. We're also in the process of interviewing. I don't have this on my report right here, but we're also in the process of interviewing for another nurse practitioner who will replace Sandy Daniels. Sandy's last day will be the middle to end of January. So we're in the process of interviewing for that position. On the business development pillar, Russ and I continue to work together and discuss strategies and plans that we can bring back to the board. Had a lot of meetings this month with physicians, kind of one-on-one meetings, also with our various departments here at the hospital. I've been attending department meetings, and just kind of, just basically rounding on the employees, not only here at the hospital, but I go out to the care center once a week and around out there, as well as the Patrick EMS and the home health areas. Our growth team has been meeting every 2 weeks, and we're just reviewing opportunities to grow our various service lines throughout the system. That's going very well at those meetings. And then, as I mentioned earlier in the finance report, Bob and I are having monthly operational meetings with our employee physicians and working with them to grow the business for their respective specialties. And then finally, under upcoming events and marketing, I believe since December 14th, we've been celebrating with our employees the 12 days of Christmas, and we're having food and games and contests during this time, kind of to hopefully liven up the atmosphere and have people break away for a few minutes for some treats and desserts and things of that nature. We're not only doing it in the daytime, but at nighttime for the night staff and the other entities, EMS, home health, Patrick, they're involved with that. And then, of course, the care center, they're involved also with activities that coincide with the hospital. So we've been busy the last month, and that's a good thing, but we'll continue to do those things in the coming months. One thing I may add also under my report is earlier this week, at the end of last week, we mailed out to the board members the annual Board of Trustees self-assessment. And so you should receive that in the mail, and we put a self-addressed stamped envelope in there. So if you fill that out and mail it back to us, we'll tally up the survey and assessment, and then we'll review that, have that for your review for the January board meeting.
Daryl, did we sign those?
It's not necessary. You can, if you want to, you can, but it's not necessary. We wanted to just, yeah, there's no need to sign it. We just send it back, and we'll just kind of look at the items that we all want to work on together.
Okay.
Okay.
Any
questions for me?
I just have a frustration that I think administration should be aware of. We give them their 12 days of Christmas, but on Christmas Day, they're going to have to bring their food if they get fed.
Okay. We've already taken care of that.
Thank you, God. The minute that thing came off the printer on Monday, I got creamed everywhere I went.
We, on Christmas, we will provide either lunch or dinner for our night staff. We've already tallied up the people that will be working that day. And so we will have...
You need to put that out.
We will have a meal for them.
You need to put that out.
I thought we had, but we will absolutely communicate that tomorrow morning.
Oh, my God, I have all the snarky stuff in the elevator that I can take.
Yeah, we'll announce it again at our daily safety huddle tomorrow morning, but we're taking care of that. So our employees will be fed on Christmas Day, free of charge.
Not Christmas Eve.
Not Christmas Eve.
That's okay. 1 out of 2 ain't bad.
Christmas Day.
The degree of snark is unbelievable.
Are there any other questions? If not, I entertain a motion to accept the senior leadership team reports as brief.
Move we approve, John.
Motion made, second. Any discussion? All those in favor, say aye. Opposed, nay. For Tanya and capture the who made that motion and who second?
Me.
Dr. Morrison did.
Made the motion, and who's that second?
Me.
Okay, Commissioner Ashley. All right. All right. Next is the chief of staff. Is Dr. Klein on the phone or in attendance there?
No, sir.
Okay. If not, a lot of his information was covered in the medical staff briefing on the consent agenda. Next is the Donaldson report.
Yes, sir. You have that report in front of you, and I will go through that and give you the highlights. You can see under leadership pillar, our DON, Lucy James, and infection control quality, Brandy Rozier, they've submitted their letters of resignation. But I'm happy to report that we've been able to quickly fill those positions. Our new DON, Director of Nurses, will be Michelle Flo, and she will start December 30th. And Michelle has been she's an employee of ours. She's already on our payroll, but her full-time job currently is the Assistant Director of Nursing at the Elk Valley Nursing Home. And so she will start with us on December 30th. The staff is excited about that. Jack made the announcement yesterday about that, and so the staff is really excited about Michelle taking over their leadership in nursing there. And then we have Ann Reynolds, who's an RN that worked at the hospital and is going to transition over, and she has already started. She's been there for several weeks in another role, but she is assuming the role of the infection control quality person. And so that was just a transfer, so we're keeping somebody in the family and just moving location. So I think Jack is building his team and getting the right people in place, and so the staff's out there excited about it, and we're excited here about these two individuals joining the leadership team out there with Jack. Under the COVID, we have, as I mentioned a minute ago, we have resumed admissions. Also, I'm happy to report that tomorrow we are starting back our visitation with the residents, so we'll have that on Wednesday and Thursday. Jack has notified the families. They will be meeting or scheduling appointments or scheduling times to come and meet with their loved ones. They will be meeting in the dining areas. We're not going to allow them at this point to go to the rooms because of the COVID. We're just going to have our staff bring the resident to the dining areas to meet with their loved ones and their family members. The family members, when they enter the building, will also have to go through the COVID screening process that we have in place at the Donaldson and of course, at the hospital. So, and the visits, we're going to limit those beginning for a 20-minute period of time and everything. That will allow visitation, but also the 20-minute period when they leave, we'll have several minutes to clean up and disinfect the area before the next group of family arrive for their scheduled visits. So we're excited about that and ready to kick that off tomorrow morning. As I mentioned on the finances, our average daily census for the month was of October was 89. November was about the same, maybe a little bit less, and as of today, it's running. I believe that when I looked at the census today, it was 83 out there. So we talked about the process of it's going to take a little bit, but we're going to work to improve those admissions and bring those admissions back. Staffing issues. We currently have 6 full-time nurses to replace the current agency nurses out there and 1 part-time nurse. And then the nurse techs, it has 14 on here, but Jack sent me a report today that we have 9 full-time nurse tech positions that we are working to fill. I believe 4 were on the day shift and 5 were at night. And then the end of Jack's report just talks about the monthly reports that he reports to me and that I report to the board on the any smoking, any wandering elopements, things of that nature. And I'm happy to report there has not been any wandering or elopements from the facility. And we're anticipating our annual survey, so we're all ready for that. And then our Q&A, the coffee committee has concentrated on the COVID-19 vaccine, and Courtney talked about that and addressed that, how that would be handled. And then also they had a boot camp for the point, click, and care system that they have out there at the care center. And that point, click, and care is basically the electronic medical record and making sure everybody knows how it operates, all the bells and whistles that go with that system. So just a re-education part that we're doing with our staff out there. And Mr. Chairman, that's one other thing is I sent to the board members today, all the commissioners received a letter on the board. I don't know if Dr. Morrison, did you receive this letter from an employee about some concerns he had at the care center, or they had at Bethesda? So what I did, I sent to each of the board members this letter, and then a letter that Jack addressed to Mr. Taylor in response to the various concerns that were brought to the attention to us. And so you have that in your email. I emailed that out around lunchtime today. So you have that in your email. Jack was able to hopefully write down, verbalize is not the right word, but to write down to you about and address those concerns. And then one of the things that we're going to do before the end of January, Jack and I are going to have town hall meetings out there with the employees, several town hall meetings with the employees out there to, address any concerns and things of that nature. We also we took COSI survey, or basically the employee satisfaction and employee satisfaction and the safety survey, and so we'll also be addressing those concerns that were brought up during that survey period to the staff out at the care center. So anyway, that I just wanted to mention that before I ended Jack's report. And if you have any questions, I'll be more than glad to address them at this time.
Any questions for Daryl?
Daryl, do you
Yes,
think you that letter out to all the employees? No.
What, did you ask if I should send that letter to all of the employees?
Yes, sir.
I don't think so.
I don't know.
Okay, excuse me.
I would kind of agree with Anthony. I think when we have those town hall meetings, we'll probably hear, John, a lot of those concerns that are addressed in that letter from the anonymous employee. So I think at that time when we have the face-to-face meeting with employees, I think that'll go over much better than just sending the letter to them.
Okay.
And if we send the letter to them, that may. I'm sorry.
Go ahead. I've had 2 or 3 phone calls with pretty much the similar concerns that was addressed in that. So, I think there's quite a few employees with some of those concerns. So, but I mean, I agree with you. But I was just curious what your thoughts were.
I think it's a good opportunity.
Yeah.
Go ahead, Daryl. Sorry.
No. I cut you off, Anthony. Please go ahead.
Go ahead, buddy.
I was just going to say, I'll kind of reiterate. I think personally, with me and Jack out there addressing them in person and listening to their concerns, to me, I think it's going. I think and I hope it's going to carry more weight than sending a letter back to them.
Yes, sir.
It's more real, and it's more real and in person. Is how I look at it.
Yes, sir. Yes, sir.
Any other questions for Daryl? If not, entertain a motion to accept the DCC monthly report as brief.
So moved.
Motion made by Commissioner Thorpe,
Second, David.
second by Commissioner Sanders. Any questions? All those in favor say aye.
Aye.
Opposed, say no. All right, the report is approved. EMS.
You'll do the Patrick first. Or do you want to?
Excuse me. No, Patrick is next. Yeah, I've skipped. Sorry.
Okay. On the Patrick, hey, Dr. Klein. Dr. Klein just entered the room, so we have Dr. Klein with us.
Okay.
On the Patrick, kind of go over that briefly. As I talked last month, we expanded our hours out at the Patrick for physical therapy, occupational therapy, and speech. So we're now from 7 in the morning till 6 o'clock in the evening, and we're having more people show up at the 7 o'clock hour. Our slots are all full for 7 o'clock. Between 6 and 7, it's not as many, but we're still getting patients in between those hours and working through lunch, and taking staggered lunches. So that's going well. We are, of course, with the COVID situation and the school situation, we're doing virtual therapy for our school treatments, and that's going fairly well. On the staff development, we're looking to add some additional PRN positions. We've had some openings there and some people departing, so we're looking to fill those positions. Regulatory-wise, we're following all the guidelines that the CDC and Courtney is instructing us on doing as far as the 6 feet apart and, sterilization and washing our hands and social distancing, those type of things. Our census remains average of 6 to 8 patient evals per day, and we have as many as 10 to 12 a day at the Patrick. That doesn't count the ones that we have here at the hospital, which can run between 2 and 5 a day. Our wellness membership, it's kind of been the same since probably April, May, in that period. just not many people coming to the for the wellness part of it. I think we're probably still averaging, I don't know, 20 to 30 people a day, something like that, if I recall from memory. And then I talked a little bit about patient safety, and then our one of our employees over there, Jennifer Bradford, she was named the Employee of the Quarter, and so they had a celebration over there that I attended and recognized her for that. She's Jennifer not only works over there as a CODA, but also is she fills in a lot here as screening, and she just kind of Johnny on the spot. She helps out everywhere. She's a very, very good employee. So that's the Patrick Therapy and Wellness Report.
Okay. Any questions? I noticed a phrase that was put in the write-up: minimize financial waste.
Yeah. That's Justin. I guess it sounds like Justin's been hanging around Bob. But anyway.
Well, it begs for us to make a decision very soon about the wellness piece at the Patrick. John, any thoughts?
Looks good.
I'm talking about wellness, the wellness program. We're losing money every month, and a normal business, when you lose money, you cut things out, and we just continue to allow that to continue to drain us. So maybe we can address this issue, because we don't need to continue keeping it when we're not getting a return on our investment.
Yeah, I think we've got to take the approach to just make a big plan and present it all to the commission as so it doesn't look like we're picking on wellness.
You know what? I don't think we need to go back to the book. I think we need to make a decision ourselves, and we made a decision based on business reason. And if the commission can accept that, they can accept everybody else's business reason. And I think we keep going to the commission and the budget committee. I think we're weakening ourselves, and we just need to go ahead and make a decision, because we're making decisions based on data. We're not based on emotions.
I agree with you. I mean, I've been for doing it day one.
Yeah.
So.
All right. Darryl, let this be an agenda item for next month. We'll make a decision next month.
Yes, sir. Okay.
All right. Okay. All right. Entertain a motion to accept the Patrick Rehab report as submitted and brief.
So moved, David.
Motion made by Commissioner Sanders.
Second, Jack.
A second by Commissioner Ashley. Any discussion? All those in favor say aye.
Aye.
Opposed say nay.
Aye.
Okay. It passed. Next is EMS.
Okay, Anthony, on the EMS, I kind of hit the highlights on the finance section, but basically our runs for November were a little down. Our 911 calls were down a little bit. I touched on the fact that our transports from nursing homes or the care center or to dialysis have been down based upon due to the COVID situation. We're seeing more transfers to Nashville, which increases, our trucks being out of the county. We are down one position. We have one open position, one open 8-hour position for our, I believe it's the BLS truck. For most days, we are running 3 ALS trucks and 1 BLS truck during the week. The BLS truck runs Monday through Friday. The other 3 trucks are, 7 days a week. The staff, they're doing a great job out there, but, I think with some of the equipment that we've gotten them, some of the supplies we've gotten them, that they feel a little better, they feel safe, and they're just out there, you know, working hard. I believe it was one day last week, or within the last 2 weeks, one day they did 36 runs in a day. And so, but they're averaging probably between 18 and 24 runs a day. So they're busy and they're on the road. So those men and women over there are doing a great job for us and the community.
Thank you. Any questions for Darryl?
That's about all for the EMS report.
Okay. Any questions for Darryl? If not, entertain a motion to accept the EMS board report as brief and submitted.
So moved, David.
Okay, motion made by Commissioner Sanders. Need a second?
Second, Jack.
Second, motion was second by Commissioner Ashley. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Okay. Dr. Klein, you got anything you'd like to add, sir?
The med staff had their elections, and since we didn't screw up too bad this year, they decided to keep all the same people, including Dr. Morrison.
Okay. Anything else, sir?
That's pretty much it. You got the consensus report and stuff.
Yes, sir. And yeah, we got the credentialing to be done too. So thank you.
Yep.
Any question for Dr. Klein? If not, attain a motion to accept Dr. Klein's report as brief.
So moved.
So moved, Jack.
Motion made by Commissioner Sanders, second by Commissioner Ashley. Any discussion? All those in favor say aye.
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 Opposed, say nay. You have any new business, Darryl?
No, sir, I do not.
All right. Under others, is this just information about what Bob is showing us about the question?
Yes, sir, that's correct.
Okay.
That's correct. That is correct.
And then on the capital, we kind of covered that. We're going to get the EMS equipment through our grant money. Is there anything else? It's just a summary of where we are.
Yes, sir, that's correct.
Okay.
Anthony, I think on the if we can make it clear on the I know that we voted on the ventilators, but just to be clear for our minutes, can we make a motion if so favored by the board to approve the EMS equipment?
Okay. It was a motion to approve the 3 EMS equipment to use grant money to purchase them, $13,877. Here a motion to approve that.
Move we approve.
Motion
John.
made by Commissioner Thornton and second by Commissioner Ashley. Any discussion? All those in favor say aye.
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 Opposed, say nay. Okay. Anything else, Darryl?
No, sir. That's the end of the agenda. That's all I have, unless there's any questions from the board.
Okay. Is there any question for Darryl? Or Carrie? Or Courtney? Or Russ? If not, I entertain a motion to adjourn.
Anthony, this is
Yes, sir.
Jack.
Okay, Jack.
Before we adjourn, I'd just like to publicly say thank you to all of our employees, from the administration to the director of nursing, our medical staff. We've got some dedicated employees that have been working very hard, overworked actually, and they seem to be pulling up. They're and doing what's needed to be done. And I just tell you, I can't thank them enough to stay on the ball. And we're getting this thing turned around, and it's all because of the people that work for the health system. And I just want to say a big thank you.
Jack, that is well said and well overdue. So thank you for saying that. And anybody else?
Thank you, Jack.
Anybody
I just
else?
want to wish everybody a Merry Christmas and a Happy New Year, and thank you for your support of the administrative team and of the hospital. And hope everybody stays safe and enjoy time with your families.
Okay. Well, Merry
Thank
Christmas,
you.
everyone. And thank you all for what you do on the board. So really appreciate the dedication that you all do as well. So we're all in this as a team. And, you know, we continue to work together. Good things will happen. So Merry Christmas and Happy New Year, everybody.
Merry Christmas. Now make that motion to adjourn.
Okay, motion made by Commissioner Ashley, second by who?
David.
Second by Commissioner Sanders. Any discussion? All those in favor say aye. Opposed say nay. That's it. Thank y'all so very much. And Merry Christmas and Happy New Year again.
Thank you.
Merry Christmas.
We're done. We don't have to push the star forward. Okay.